Hey, it's Brian from Strong Tower Training, back with some research today on osteoarthritis in the knee. So we'll have the study pop up, an image of it for you so you can look it up if you want to. And basically what it was is a meta-analysis. It's adults 40 and up that are asymptomatic, meaning no symptoms, uninjured, and they have osteoarthritis, and it was 4,751 adults. So we're talking about, over 4,000 people. It's a big study. They found that there was 24% of knees represented with cartilage defects. There was also 10% of the asymptomatic knees represented with meniscal tears, so a tear in the meniscus. And they also found that the conditions, those findings on MRI, increased with age. So the prevalence went up as you look decade to decade, and the ages went up as well. Wanted to share just a couple quotes from the study because this helps summarize it a little bit and shed some light on potentially how careful we really need to be with our language in working with clients for us, patients in the doctor and orthopedic settings. So the first quote here, there's a high rate of asymptomatic adults 40 and up with knee osteoarthritis on MRI. And this high rate helps explain why interventions such as arthroscopy or arthroscopic surgery, interventions such as arthroscopy are no more efficacious in reducing symptoms than sham surgery. So to break that down or summarize it, basically there's been sham surgeries done on knees, and they found that the outcomes, the long-term outcome is maybe no different whether the person had the arthroscopic surgery or whether they didn't. And that's been done in this setting. It's also been done like on meniscus tears. So there's another big review on meniscus tears where they did sham surgeries on one group, and they found that those people got just as good of results as the people that actually went and had the real surgery and then went through physical therapy as well. Physical therapy was a second part to those studies. But it's interesting because the MRI showed an issue in some of those cases where they did the sham surgery. Sometimes there was symptomatic. I think there's been research both on asymptomatic and symptomatic individuals. And they're finding that the surgery itself doesn't actually produce a better outcome than not having the surgery. So just information to get out there, but more and more research is coming out like this, both on spine imaging and on knee imaging, and how important it is to have multiple factors in terms of assessment and diagnosis. So not just looking at an MRI of the knee, not just looking at an MRI of the back, but having a conversation around multiple factors and then maybe multiple options for the patient or the client to take a look at. So facilitating potentially more options that may actually produce more successful outcomes could be important. I'm saying it's really important. Some people are going to tell you it's important. Some are going to try to kind of like brush this off. The next statement towards the end of the study, just as another summary statement, imaging also did not predict non-surgical treatment outcomes. So when you have non-surgical treatment interventions, the imaging itself, just the MRI, was not predictive of the outcome that person, that individual had with their knee. So wanted to get this out there, just share it with you, break it down a little bit. If you want to nerd out, of course, you can go to the study. That's why we posted an image to it. We'll post a link to it as well in the video. Remember to subscribe to the channel. It helps to know our neurology.